As part of what we do, we have the community work as well. And community work, either student-based or lecturer-based, kind of, where students are assigned to go to various communities, go and diagnose the community, and then provide interventions. And we do it yearly, and each student in a group of 4 will pick the rural communities around us. In fact, I think that we are limited, and so we usually will focus on the rural communities around Agogo. And so they go and do all that. And I think that the services they provide in terms of intervention, so interventions vary based on the diagnosis that they will find in the various communities. And mostly they provide report of that, and I have example of such report here. This is for an individual student who had finished and given his report. And so yearly we do that. And we are thinking that is the services that we can provide for the community.
Whether benign or malignant, yet they also appear commonly in the service. So we have cervical erosions, which are very inflammatory.
The nursing and midwifery programs are accredited by the Ghana Tertiary Education Commission and the Nursing and Midwifery Council of Ghana. And for that matter, the government also recognizes these bodies. And so products from this university are employed by the government into the various hospitals in Ghana, and internationally too. Our graduates have been employed in institutions that needed their assistance once they put in applications.
Beyond academics, the campus prioritizes holistic development through the Chaplaincy and Life Values Promotion Center.
I can state emphatically, without any equivocation, that our products are in higher demand in the job market, because in this university we train the heart, the head, and the hands. And for that matter, our products are God-fearing, very disciplined, and skillful. And that is what the employers or those who hire are looking for. And so our products are very marketable in these areas, so in Ghana and abroad.
This center is committed to cultivating the overall development of individuals by promoting Christian principles.
The university has various core values which are unique in our moral upbringing, particularly faith in God and commitment. Also, the university teaches us to be passionate and then committed to everything we do. Also, we know that to excel in my field of studies, you have to be selfless, you have to be dedicated and then committed in what you do. And the university ensures that.
As the motto of the school states, discipline in leadership, this connotes the fact that discipline is the hallmark of the university. As a pattern of behavior like discipline, it has aimed in helping me build a very strong interest for effective time management, prioritizing tasks, and also staying focused on academic goals. So this has to do with developing regular study routine, setting goals, and also maintaining strong work ethics. As a matter of fact, this discipline imbibed in students has helped to curb the menace of examination malpractices and other immoral practices and their implications on the lives of individuals.
The impact of these principles is evident in the transformation of the entire student population, guiding them towards socially commendable statuses.
The discipline and the character enforcement here has placed me on my foot and made me more focused on my profession. So I entreat anyone out there who is ready to enter the university to choose no other university than the Presbyterian University Ghana.
The university has a good and friendly environment for learning, and also it instills in us a level of professionalism and also personal development. It has professional teachers who are dedicated to their work and they are friendly to all students. It also has a lot of facilities, so I highly recommend anybody who wishes to pursue a career in physician assistantship, nursing, or midwifery.
We organize health promotion activities, like going to the communities around us, giving them health talks, and then organizing screening for them. And through this engagement, people around have come to know the university and have also come to know the programs we run in this university. And they have also benefited from some of these services we render to them.
A significant asset to the educational experience at the Asante Akyem campus is the Presbyterian Hospital, established to facilitate practical sessions for students.
Every semester we go to the hospital, that is the Agogo Presbyterian Hospital, built by the mission, every 2 weeks for an intensive clinical sections where we get the opportunity to experience real life situations and learn from trained and qualified nurses and doctors, and they tell us how to perform certain procedures.
So when the students come around, they spend 8 weeks in the hospital, 2 weeks in each department. So when they come around, we take them through history and physical examination, and also management of some emergencies on the ward.
This hands-on approach not only enhances their skills, but also elevates the standard operating procedures within their chosen fields.
The core benefits of this clinical session is to help us put into practice what we learn in class, and then also in a situation where you are posted to a facility where there is no obstetric and gynecological specialist. It is the duty of the physician to care for pregnant women and educate them on what to do and what not to do in order to carry their pregnancy to term, to deliver healthy babies, and even also how to take care of their babies after delivery. This will also help us to manage minor cases about the female reproductive system, and also help us to build good and healthy relationship with other health workers on the field, since it is a teamwork.
Students benefit greatly from direct interactions with practitioners and exposure to real-life situations, enriching their learning process.
Currently, I and my colleagues are at the ONG department, the obstetric and the gynecological units, where we understudy pregnant women, some of the conditions associated with them, and also at the labor ward too, we learn how they deliver the babies, some of the complications that the babies come along with, and how to manage those complications, and on the advice too, we give them when they go home, and how to take care of the babies so they don't get sick and come back to the hospital again.
Most of them already have the basis already. They are already being taught physical examination, history taken in their university. So when they come around, we just build upon that. So most of them are able to pick up early, and they are performing well.
The lectures, they are not just doing lecturing, but then they are teaching us. Yes, they are really teaching us for us to understand whatever that we are being taught in the class. Yes, and then after the theory aspects, they take us through the practical aspects to know more about what we are learning. Because when you get to the hospital like this, you are not just bringing book, but then what have you experienced? Yes, that is the skills.
I didn't want to study in Nigeria because I wanted a change of scenario. President faculty and the students have been very welcoming to us international students. We really love it here. They make us feel at home. They don't even make us feel like, yeah, we miss home and all. It's been very good here. The lecturers teach. Some lecturers lecture. They teach. They make us understand whatever we have been taught. They make sure we understand, and we ask questions for us to be able to understand whatever we are being taught.
We have in plan, and we are developing curriculum for Master of Science in Nursing and Master of Philosophy in Nursing, and then Masters in Midwifery, and also Master of Philosophy in Midwifery. And so we seek to come on board with these programs, and even as we also promote staff development. In some few years, we would also be adding a PhD program in nursing and midwifery.
So when we come to the classroom sections, we are fortunate and lucky to have
well-trained and qualified lecturers who teach us the needed things that we need to know. So the classroom sections has provided me with the theoretical framework and also concepts and principles that I need to know as a BSc nursing student.
The Presby Church, Ghana, and then management of the university, they've taxed the faculty here, and the main goal is to have medical school as well as develop the allied health sciences, the programs. And so we have lined up a lot of programs that we are planning to enroll. So you can just pick from what I said earlier on, that 2021 we started with the midwifery and then the MPH. We have in mind, not in mind, but in process, accreditation process, masters in nursing, masters in midwifery, we have optometry, BSc in optometry, and so many programs. In fact, we have even started with the skills lab. We built skills lab for optometry, and that is our goal. We want to promote health in Ghana and internationally.
To sum up, the Asante Akyem campus of the Presbyterian University Ghana delivers a well-rounded educational experience.
I am a level 400 PA student, and I am here to examine your cardiovascular system. So, I'm going to examine your chest to know how your heart is working and how blood is circulated to all parts of your body. So, in the course of the examination, I will expose certain parts of your body and also be touching certain parts of your body. In case you feel any pain, you let me know. So, do I have the permission? Thank you very much.
With a focus on health and medical sciences, complemented by a dedicated hospital and values-driven approach, students not only gain academic knowledge but also practical skills and a solid moral foundation.
So the blood pressure is 120/85 millimeters of mercury, and it is within the normal range. He is a healthy young gentleman. We also put into practice the theory that we learn during lectures. So we use dummies and also purposely design slides and films. This allows us to appreciate the concepts in which we are being taught during lectures. I have a positive impression about this university because the university have had two main positive significant impacts on my life. First, the university allows and also supports and nurtures academic excellence and also encourages personal development. And here in this faculty, we have professionals and also academic experts who are not only knowledgeable in their field of teaching, but also they are self-motivated, they are experienced, they are competent, and also they are passionate about their work. And because of that, they serve as role models to us to help us in our future profession as physician assistants.
I will recommend Presbyterian University Ghana to every student out there who wants to study in the health sector in respect to physician assistantship, nursing and midwifery, to make Presbyterian University Ghana their first option.
Presbyterian University Ghana, discipline in leadership.
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 Discipline in leadership.